So, hello, my name is Promise Odera Onu, and in today's live, I want us to discuss on what should be the best practices when it comes to healthcare and the value of life. And of course, I'm going to dwell on Nigeria, or not just Nigeria. I'm going to look at different countries and then look at the way their healthcare system is being uh, structured to make sure that their populace or their citizens get the best of health services and look after themselves, including their mental well-being. You see, when we talk about healthcare, healthcare covers both orthodox medicine, your mental well-being, community well-being, population health, including things like outbreaks, pandemics like the COVID, acute. So when people have emergencies, so all of these are covered in healthcare. So we are going to look at it and see what is the best or what should be the best practice today in today's world. Now, when you look at countries all around the world, there are countries that make their medical system or their healthcare system to be free. Some places, like in the Western world, you need to have an insurance, except you have emergency, where they could, like America, they could, the government could, see that they treat you, even if whether or not you have insurance. I beg to be, I stand corrected if that's not the case. But somewhere like UK, where I am, the NHS is totally free. I think the NHS stands for National Health Service. So we are going to look at that compared to what is obtainable in Nigeria. So I think every Nigerian at one point or the other have had an encounter with the healthcare system. Say that first of all, you were born in the hospital. If you happen to be born elsewhere rather than the hospital, maybe local maternity services or people that give birth at home or in transit or whatever, you must have at least gotten an immunization in the hospital, or maybe during your time in your life, there must be a time you probably have needed to use the health services because of one illness or the other. So we are going to look at how easy it is to obtain healthcare in places, how efficient those services are, and then how accessible it is, and then to what extent are people confident in that system. And there's no way I can talk on this topic without mentioning the medical tourism that our political elites engage in. And that speaks for itself. It shows that there is little or no trust in the medical system or in the healthcare system of Nigeria as a whole. And I've seen people brag that we have the best doctors in America, we have a good number of doctors abroad, including the UK and other parts of the West, and even Saudi. A lot of Nigerians are going even to the East, going to the Middle Belt and all the rest. Of course, for greener pastures, because Nigerian doctors or medical workers earn a pigeon compared to what their counterparts earn elsewhere. But then that said, it's quite important as well that we look at what are the enabling factors for those immigration from Nigeria, or our doctors or medical system or medical practitioners leaving the country. And as well as that, we need to sort of understand what is the role of the government in all of this. Medicine is starting from the doctors. Medicine is one of the courses that will take you one of the longest time to sort of complete in the university. Yesterday I was speaking on education, so this is like a continuation, so to speak. After my introduction, I spoke on leadership, and after leadership, I spoke on education, and now I'm speaking about health. So if you look at the topics, the way I'm choosing them, you can see I'm building one on top of each other, like laying blocks. So if you look at the health system in Nigeria, personally, I've practiced in the health system in the UK. So when I say practice, I've worked in the health system since I finished uni. So this is one that, is a little bit personal, not too personal, but this is a little bit personal because when I met one of the presidential candidates, which is Peter Obi, who's my principal, the few minutes I met him in Oxford University when he came to the UK before the elections, I tried to speak to him, although it was of course a crowded event, and he just finished speaking to the students of Oxford. I was trying to take a picture, but at the same time trying to speak to him, and he was a bit distracted. But then he asked me to join the doctors and medics for P2B support group, which I did, and those guys are really, really, really working, tirelessly to make sure that he achieved his mandate, which we knew he achieved. But then the processes in Nigeria have made it to look like it's going to be a long walk to office. So he has to go through the judiciary, which a lot of us don't have faith in. But he's assuring us to be calm, and the rule of law will take its course. But then what I whispered to him is my idea of what I think Nigeria should be doing, and this is it. Nigeria has fantastic doctors. I mean, our education might not be so practicalized, but we have people who are very good in theory, who read the books and do the little practical they do in labs, with rats and whatever. I don't know how good our research are, but once researches are done elsewhere, Nigerians are good in reading them up. So we are very good in theoretical sciences, or picking up what is there written in the book. So we have fantastic doctors. Of course, when they go abroad, they have to do some kind of examinations and brought to speed with what is happening in those countries before they're allowed to practice. But Nigerian doctors can work almost in any part of the world. So that tells us that we are in terms of human resource, we are good. So, but what is the problem? Now, the problem is that we don't have well-equipped hospitals. It's so laughable. I was watching a live by Peter Bojole where John said he went to a hospital with his son, and then a little child come in a whole teaching hospital, and they had only one oxygen for the whole hospital. Oxygen, only one for a whole hospital. So these are the critical states that our healthcare system is in Nigeria. So I think every one of us that have used our hospital system as well can bear witnesses to these things. It's not like I'm trying to paint Nigeria bad when that's not the case. It's not like I'm trying to speak ill of my country. These are things we want to start addressing. What part is the government's fault? What part is the medical practitioners' fault? What part is the people's fault? Those that use those services. So I'm going to try and address all of this, and I want you to sort of follow me and comment if you have any idea, or if I'm speaking the facts, you can comment and support what I'm saying, or disagree if you have a dissenting opinion. So first of all, I think one of the major problems, like I established, we have very intelligent people, extremely intelligent people actually, in terms of our medical practitioners, nurses, doctors. They are all over the NHS. They are all over hospitals in the Western world, in the civilized countries working. So we know we have human resource. So again, what is the problem? Why is our healthcare so bad that there's a lot of medical tourism in Nigeria in terms of our political elites always trying to go to other places looking for medical attention? We know about Tinubu, the president, or the so-called INEC president-elect, not even president-elect, because that was a sham of an election. But then he's already gone to France, as they claimed, that he's gone for medical tourism again. And even before the election, he's gone a few times as well, to either go and rest or to go and get medical attention. And we knew when Buhari was in power, he lost 8 good months, while he was abroad for healthcare. And then Aso Rock has a clinic. You should imagine that the best of doctors in Nigeria or consultants should be in Aso Rock, ready to serve the number one president or the number one citizen of Nigeria. But it's so it's so disheartening to know that even the first lady said at some point, Aisha Buhari said that even the Aso Villa clinic don't even have paracetamols, and they're spending billions in terms of capital in that particular clinic. Personally, I've been to Aso Rock. I've seen the level of luxury that they live there. So again, why they don't have that level of sophistication in terms of medical supplies and everything is what I don't understand. So that's the first thing. The first issue, we don't have equipment, we don't have medical equipment, medical supplies. A lot of things when it comes to medicine is quite expensive. A lot of them, Nigerian produce a lot of drugs, but then quite a lot is imported. Things like oxygen, I don't know if they are made in Nigeria. I don't even know where they import them from. But then there are things that are very timely to the survival of a human being or a patient when they come in, and one of them is oxygen. When people can't breathe normally, you sort of use oxygen to help them. I'm not a medical practitioner, but I know it's one of the first things they do. But when you fall sick in Nigeria, I mean, I grew up in Nigeria till I was 18, 19, but then the first thing they will give you is drip. So almost everybody will get drip. I don't know which one is better, drip or oxygen, or both should be used on people. But when we look at the health system, we know there is issue with equipment. Now, that particular issue, when you compare the public hospitals with the private hospitals, I don't know if it goes away though. I don't know if anybody here can attest to the fact they've used any private hospitals or private clinics. Were there equipment? Was it a matter of money? And how much, I think somebody was trying to say that oxygen cost about 5,000 a day, like to stay on oxygen. I'm not sure. But then if we look at the system of the healthcare system in the UK, for example, where it's entirely free, I will tell you that's one of the reasons why I love the country I am more than, say, for example, Australia or I think Australia has a hybrid system when it comes to healthcare systems. It's partly paid by the people and it's partly paid by the government. How long will we keep talking about these issues in Nigeria? My brother, I don't know. Honestly speaking, how many times have I given up in Nigeria? I've given up on Nigeria a million times, and I've tried to sort of regain consciousness of who is going to do it for you if you don't, get involved. So this is, all us. You see, Mr. Peter Obi did something for us. Mr. Peter Obi united us, The obedient movement sort of brought minds together, and we are now talking and having these conversations, having a lot of forums where we talk, and that's one step, to the right direction. So we need to keep talking about these things, because some of these leaders are empty. They are just fortunate criminals who have been selected to run office. So when they are there, they don't know what to do, and they get insulated to know what is the real pain on the street. And most of the people that are surrounding them are there praising them. Nigeria, politicians have the most beautiful names. Your Excellency, distinguished, which other one? The way they refer to them, you probably think they are saints or they are God. So they don't know that they are doing something wrong. Someone like Buhari don't even know he has failed woefully. He's probably been told they have one of the most excellent administration. So until they come out of government and they really get hit by what is the real news on the street. But then let's go back to topic. That's why we have to keep talking, my brother, responding to what you just said. But then when you look at that system that we have, or the system we have in the UK, it's entirely free. As a parent, I look at my child, I see that he has like ear infection. I call 111. I don't even want to call 999 because it's not even a big issue. As a matter of fact, the other day my phone was hanging, and I don't know, I was trying to switch it off. I don't know when my phone rang emergency services. Immediately the woman answered and said, "Oh, this is an emergency line." I said, sorry, I don't have any emergency. Please, can you hang up? My phone is hanging. That's how a system works. You know that in any situation you are in, you could get help. That's so reassuring. So I don't mind how much tax I have to pay in the system. It is a system that works. So I called 111. I said, 111, my child has this issue. Can you imagine, on an evening, on a Friday, within, will I say 15 minutes, a doctor called me. I was even the person saying, oh, my GP is closed because it's Friday and, tomorrow is weekend, so they won't open. The woman assured me, I'm going to get your doctor to ring you. And that's exactly what happened. And they didn't stop there. The GP now said to me to drive down. So they have to wait for me out of hours to make sure they attend to my son. I'm telling you what happened to me personally, right? So I said, okay, I was even now telling the doctor the time I want to come. I'm going to come later because I'm driving somewhere else and I'm going to come back later. So, and that's exactly what happened. So I came there. They said to me, don't worry, they're going to wait for me. You know, ask me what time. And, you know, I came there and I met the doctor. The doctor assessed my child, looked, and then gave a prescription. So I had to go to the pharmacy. And guess what? The prescription is free because it's a child. So how do I look at a system like this, right? And say, I don't want to belong here. Oh, because I'm Nigeria, I have to have one passport. No. I'm going to keep this British passport, man. Because I know my children are secured here. I know I'm secured here. I know I'm guaranteed, you know, help in any emergency. Okay? So, this is my proposal to Nigeria, right? When you come to Nigeria, you have government hospitals, you have a lot of private hospitals. In terms of equipment and supplies, I don't think the government hospitals have enough, right? Unless anybody has a contrary opinion. But then the private hospitals might do, depending on the capability of who funds or who owns the hospital. Now, this is it. I said to Peter Obi, I said, it is best if we practice or adopt what the UK system is, right? Which is, the UK government sort of pays doctors to diagnose patients, right, free of charge. So you can go see a doctor and a doctor can give you diagnosis, because that's where the major problem is. Honestly speaking, in Nigeria, that's where the major problem is. You have any type of feeling or you're feeling any type of way, what is, okay, let me ask this as a question. What does your moms, your brothers or your sisters, or you yourself, if you're in Nigeria, what do you do when you are sick? Most people, a good percentage, more than half of those percentage will have to go to a chemist. Most times a quack chemist. Chemists who have been trained, who have not been, when I mean trained, who did like apprenticeship or they learned on the job, who didn't actually go to uni to become a pharmacist, right? They'll probably go to a chemist and get administered a drug. Oh, what is your, they will ask you what is your problem. Now you will tell them your symptoms, but then that's not your problem. Because what you have is your symptoms, but then they're supposed to diagnose you with what is your problem. But then eventually they ask you what is your problem, and then they will tell you how much that they will charge you to give you a drug. Number one, you're not even checking if those drugs have expired, because they don't give you the drug in packs unless you're asking for a specific drug and you want to pay in pack, right? And then you can check the expiry date. Most times what they do is that they bring out little bottles of drugs and then mix and then put it in one waterproof and give to you, and you go and drink. So there's no diagnosis, there's no test, right? Most times people diagnose themselves. Nah, I think I have malaria. I'm having headache. I think I have typhoid. And if it gets more serious, it becomes witches. So these are the problems, right? So unless you are now so down and weak and whatever, before they now go to the hospital and then admit you, because usually it is more expensive. They charge you more money to give you a bed, to admit you in the hospital. So people don't usually go and, you know, give themselves to that because it is not free. So they rather be taking this cheaper system of health, of healthcare, which is buying all these drugs without any diagnosis, and then hoping and then supporting it with prayer, which is now a spiritual help. Now, compare that to what I just explained that happened to my son. I've gotten a doctor to invite me down to do an observation to make sure it's not what I'm just saying, although I've already gone through series of questions and, you know, to arrive at a particular decision with the 111 service. The doctor still wants to see me to make sure they confirm and then give me a drug and also ask me to return back, which I did. And further on, you know, I've referred us to a proper specialist in the hospital for my child, all free of charge. all within minutes, right? They are the ones chasing you. They are the ones sending letter. As I'm talking to you, there's a letter that's just behind my system now, for my child. So what am I trying to say? That is a system that works. Now compare that to what I just said. A child has a problem in Nigeria. What is it? What is the first thing you do? If your mom has paracetamol, that's the first thing you're giving to the child. If you persist, they will now take the child to go to a chemist and say he's not feeling fine. What is the problem? I think he has malaria. And that's it. They will mix a drug of malaria. Now, if you're opportune to be part of the rich people in Nigeria, probably you will go to a private hospital. Now, in that private hospital, most times you have general practitioners who are not specialists in anything. But then the specialists will most times be in the teaching hospitals, right? So if the private hospitals try their hands and things doesn't develop, they will tell you, okay, your situation is now bigger than us. Go to a teaching hospital. And I remember when my dad died. My dad died with, is it called partial stroke or half stroke? I don't know the right terminology. When half part of the body has paralysis. We woke up in the morning and he's lying down there, because there is no light, there is this NEPA issue. This was before NEPA was changed to PHCN. He was sleeping on the bed floor because as a big man, if he was on the bed, he sweat a lot because there is no fan. So there was no light for the fan to be on. So he has to sleep on the floor. And then when he's sleeping on the floor, when he woke up in the morning, we saw he's been covered in sweat. So we was asking, well, this sweat is too much. It's as if somebody poured water on him. And then realized that he couldn't talk properly and everything. And so we rushed him to first of all, a hospital that was like a family hospital, which is very close to us. Now a private hospital. So from there, the doctor tried his best and said, okay, fair enough, you have to refer him. So they referred him to a government hospital. And from a government hospital, they referred him to what do you call it again? University Teaching Hospital, UTH or UNTH, I don't know which one they call it again, in Nnewi, and that's where he passed on. So when you look at the system, I said I was trying to look or picture Nigeria as as this supposed to be the solution. Since we have a lot of private hospitals, why not the federal government of Nigeria take on these private hospitals, right? Which are probably doctors that have been trained probably in foreign places or abroad, who have come back to Nigeria to return and help their people, but don't want to, because most doctors start their career from the government hospital, from the teaching hospitals, and then they want to probably go out abroad, and probably when they've made money, they come back and build their own private hospitals. Now, why not to employ all these private hospitals and government pays for their diagnosis, right? So they see patients, diagnose patients, then patients can now use their diagnosis to go and get the right drugs from qualified pharmacies like the Pax. I think Pax Pharmacy is one of the biggest brand in terms of pharmacies in Nigeria. Anyway, in the East, I don't know about all over Nigeria. So I think that should be a better system, because if we manage to checkmate that diagnosis level, a lot of lives will be saved. Because what we have in Nigeria is that if you even see a nurse to tell you or to diagnose you in Nigeria, you'll be lucky. And most nurses are quacks. We know how nurses come about in Nigeria. Most of them are like trained. I'm looking for a job. Your uncle is a doctor. Come, I will give you up in a clinic. They give you white dress. You don't become a nurse. No training. And usually, nurses cannot give diagnosis abroad. Nurses cannot give prescriptions abroad, unless it is, of course, very less side effects. But usually, if you are not a doctor, they don't born you well to say they give prescription abroad. You lose your license, especially if anything happens, especially if you have to involve with a child. So why am I trying to say this? All of us, at one time or the other, have lost a family member to the health system in Nigeria. So this should be personal to each and every one of us. What is the best practices today when it comes to health? If you're lucky enough to be British, you're okay. If you're lucky enough to be in a system like America and you have an emergency, you know you're okay. If you're lucky enough to even be in Australia, you know half of it is covered by the government, you're okay. There's strong systems. Even Italy is free health. Italians enjoy free health because my wife is Italian. Now, if you look at some other, because people tend to mistake democracy as equivalent of having a working system. No. Democracy is a system of government practiced by most Western countries, right? they believe is the best system of government. But then there are also other countries who are not necessarily democratic nations, but they have a civilized and working system. Very perfect. UAE is one of them, right? UAE, I think they have the strongest passport in the world now. Not even Singapore anymore. If you're a citizen of UAE, you probably have the strongest passport. In fact, you get assisted in everything. There is no level of benefit you can get. Do you understand? So it's like that country looks after their people so well, including their health, their health system. They are well paid. They look after their old men. They look after their children. They look after their people. So, and they're not democracies. So when you look at all this system, what is important is that you love your people. You want to work for your people. You want to make sure your people are getting the best. And sometimes I look at democracy as not even actualizing that, because we've been practicing it for 60 years in Nigeria and nothing is coming to be. There's nothing happening. There's no basic amenities. There's no good health care system. Our presidents are even leaving the country together. And it's like, it's either we change the process of getting these things people in power, or we have somebody that can be, even if it's a monarch system, or even if it's somebody that does not practice democracy, but give us what we want. Look at China, it's not a democratic nation. Look at Russia, it's not a democratic nation. You have so many other countries which are strong, who are doing so well, and they're not democratic necessarily. I'm not saying anything against democratic nations. I've given an example of where I am. I'm in a democratic system, and it works. So what is most important is, who are those in power? Who are the leaders? Do they even love the people? Do they want the people? If your governor is driving past and I've seen an accident, will he stop and make sure, those people involved or victims of those accidents receive the best health care? That's the problem. So this is what I'm proposing, that the best practice should be federal government of Nigeria engage all these private doctors to at least offer free diagnosis. You have an issue, you are rushed to the hospital, they diagnose you, scribble that in, and when they are scribbling that in, they scribble it in such a way. Not even here, they don't scribble anything, no. Here they type it out in prescription papers. The only thing is that those prescription papers are very, very hard to get. Except you are a medical licensed practitioner, you won't have access to the prescription paper, because that prescription paper is what a patient will use to walk into a pharmacy and be able to get any drug. So it is not easy to come by those prescription paper, right? Now, we need to find a system of, making sure our doctors can administer diagnosis to our patients, so that way we can make sure we reduce drastically all the misdiagnosis that is happening, ill diagnosis that happen in Nigeria. Because you see people with probably an earthworm being told they have running stomach, or somebody with ulcer being told they are having spiritual problem, or so many people don't even understand what is wrong with them, and everybody categorizes everything as malaria. It's either malaria or headache or spiritual problem, unless you are now completely down and they do tests. And most people, I've seen a doctor that came to the UK saying that most labs in Nigeria don't have the specimens and the equipment to do the labs. That most laboratories are ill, equipped in Nigeria. So here, of course, there are some times when I bring my mom here, when my mom comes to the UK, he goes through series of tests. They cannot just start treating you, because even though they know your history, for that particular occasion you've come, they have to put you through another series of tests. And they have to keep investigating, they call it investigating, to make sure they find out what is wrong before administering any drug. Because every drug has a side effect. And this all borders on the value of life. As a matter of fact, the last time my mom was here, she was treated by a specialist. And the specialist said he had to go and get an authorization to be able to approve the kind of medication, because they have to make sure the medication is tailored to her. Because the kind of virus she had to be tailored to her. It's not something you treat with the universal medicine. It took months for him to come back to us, the consultant to come back to us, to get my mom that, and I paid nothing. So that's a system, You can be proud. And this is why sometimes when you see people saying, I can die for my country comes first, service before self. All these things are because they are in a system that they know, even if they die, their children are okay. But in Nigeria, who can die for anybody? When everybody provides power for themselves, provide good road for themselves, provide their own transportation. Do you know, the other day we were having a conversation. If you are in a yard, what I mean by yard is all these multi-story buildings that you have many families living in different like flats, okay? Block of flats. Now, if you're in a yard and you have a car, and anybody in that yard is due for delivery, a pregnant woman, there's most likely a chance that you will be the one getting a knock on your door, no matter what time it is, to come and take the woman to the hospital. Because there's no ambulance services. Yes. So a lot of people have to depend on individuals to be able to transport themselves to the hospital. They have to depend, like this past election when people were shot in Lagos. It was somebody that brought his car, had about 7 people with gunshot wounds being taken into his car. To the point that the seats were filled up and they had to open the boot and the extra people had to go into the boot. Somebody with gunshot wound in a lot of pain. Where you know, even in this country, if you have an accident, you don't touch that person because that person can get worse. Situation might, deteriorate if you don't know what you're doing. If you're not a medical practitioner, you have to wait and call the ambulance services. The only time you can get involved is if that person is in a place or, can be of more danger to themselves or to other people. You can help that person to sort of go to a place of safety. But in Nigeria, you see somebody that is already dying, they will even help you to die. No ambulance services, no value of life, no healthcare. Nobody is even concerned. And there's this stupid law that if you are shot, for example, you have to first of all go and get a police report from a police station. I'm not saying it's wrong. It's of course to know who have been shot by police and who have been shot by army or who have been shot by criminals. But can you first of all save the life? Because somebody that is dying, losing blood, who is going into shock, and who is possibly going to die from the gunshot wound, is not going to be running. It's not going to run. So save the life first. There's no value for life. And they tend to post these things on the law. Oh, the law says, and again, this is why I keep saying Nigerian constitution is just full of like rubbish. In fact, all the issues we are having in this particular election, this presidential election that just finished, is purely, issues emanating from the constitution. That is not clear enough. Look at now, INEC is now saying, they have to go to the House of Assembly to change the laws on the REC because of the REC in Adamawa that have gone, that have gone missing after what he did in Adamawa, declaring an illegal result. Now, because of that, they are now trying to say, we should have the powers to, because even the INEC chairman cannot sack the REC because the REC is being appointed by the president. So only the returning officer is being picked by the INEC chairman. So most of the issues we have in this 25th February presidential election is from the constitution. So that constitution has to be looked into properly, very, very critically. Everything. If anything, thrown away and a new one being drafted, let them adopt the confab report. The Referotimi have actually proposed a constitution that can be taken and developed because the way we are running the country is wrong. How can somebody come in instead of emergency and you're telling them to go to a police station? So if it's a night time, they have to go to a police station or find a police station they can get approval, and the police will start asking you, are you the criminal? Are you the what were you doing? Where did it happen? And there is no record, no way of communicating between themselves to actually know what happened here. Okay, can I call the police? Can I call the station? Can I call the unit that has been deployed there? There is no connection for them to verify whatever story the person is trying to say or collaborate it. So these are the issues. So first thing first, I was trying to say to Mr. P2B, please sir, when your government come in, we need to look into this. Because I've lost people. I came back to Nigeria a few years ago. My little cousin, bless her soul, I was told she died. I was like, what? And I came back to the village for the burial, and lo and behold, her body is still in her dad's car. And I asked what happened. She left the village after my grandfather's burial, went back to uni, started complaining of stomach ache. The uncle went to pick her up from the park, and eventually things got worse. The father had to keep moving her from one private hospitals, to the sisters hospitals, to another teaching hospital, and all of this, he has to be paying for admission fee. He has to pay for up to the gloves, even the gloves the doctors or the nurses will wear. He had to buy them. This is somebody that's trying to save the life of his child. And eventually, they pronounce the girl dead. But then the man is saying, her body is still warm. How is she dead? She is not dead. She's just unconscious. Leave her in life support. Do you know there are people who have been in life support? In this country, you cannot just remove anybody from life support for a long time until the family signs and say, okay, we approve that you can allow this person to go. Because there have been cases where those people can stay in life support and still come back to life. But in Nigeria, because there is total zero value for life, actually, a big political personality in Nigeria said the life of a cow is worth more than the life of a human being to them. So if you kill a cow, they are ready to kill a whole village. And that is the country we call our own. So we're in a serious problem. We're in a serious problem that the death of people in Nigeria means nothing. It's not news. It's normal. Whereas in other climes, one death of an American or one death of a British is going to cause a whole lot of inquiry. Somebody has to... I mean, look at what happened. Dominic Raab just resigned. For what? That he was, alleged bully. They should come to Nigeria and see what is bully. Where politicians will tell you on TV, tell you in front of you, bully you. Personally, you will be seeing it. And nobody will send. And these are the people who are trying to copy their system of democracy. But we are not understanding what democracy is. Because we have a lot of uneducated people who don't understand what is leadership, people who don't understand, who are not even educated in the first place, who got into power from radicalism. So we have a big situation in our hands. But going back to my topic, my cousin, the father tried everything, bought all these things. And the thing is, you go to a consultant, you pay, you get the prescription, you go to a nurse, or they will direct you to where the pharmacy is, you pay the money, you collect the drugs, and sometimes they will tell you, we don't have this drug here, go here and collect it. And, you have to be doing all of that yourself. And eventually, when you get the drug, you come out and they've already pronounced your daughter dead. And that's what happened to him. No ambulance, no nothing, the man had to put the child back in his car, and because he was sit at home in the east on a Monday, he had to even risk his life driving the child all the way to the village where he was before the incident occurred. So, what am I trying to say? I lost a cousin, she was buried right in front of my eyes. We tried every sort of prayer, we prayed and prayed, called pastors, tried everything to see if we come back to life. Even some people are trying traditional ways to see, some traditionalists who are asking for 150,000, and I'm asking, if we pay this money and this child doesn't come back, are you going to give the money back? And they're saying that they don't discuss that. So we're in a situation whereby a lot of us are the mercies of, will I say God? Because God has given us wisdom, but then we choose to be wicked to ourselves. We know the right thing, but we choose to be evil. I mean, there's so many issues. I'm sure you probably have one in your family that you can attest to, where the hospitals failed you, where the doctors or the quack nurses or the quack doctors have managed to help kill your family member. So these are very personal issues, and they are very, very serious things that we should start looking into in terms of getting them right. What are the best practices today? How do we start curbing this issue? If our lives don't value, if our children's life don't value, if our elders' life don't value, do you know Italy as a country have the highest number of old persons, right? Italy has a free medical service as well. So if you are sick, you can get free medical attention. And that's why they are managed to preserve their oldies. In Nigeria, when they say an old person died, they won't cry much. They will say, okay, it's an old person. They don't even understand the importance of preserving old people. Here in the UK, if you are old, even if you don't have family, government will take care of you. Provide a carer for you, put you in a mobile care home or in an old people's home, provide you a carer, provide you everything, feeding, everything well structured, transportation free. How then do you tell me to leave this system? To say I don't want to be part of this citizen, to come and be a citizen of Nigeria only to prove my love for the country. My brother, I will be a British citizen till tomorrow. Because we are very, very far away from getting to where we need to be in terms of our medical or healthcare system. If you don't have private jet like Tinubu and flying away once you have any emergencies, or if you don't have private jet like Buhari, to fly away and stay 8 months in a foreign land until they get you fixed, what are you going to do? In that 8 months, he left Nigeria in autopilot. They even have to force him to allow Osibanjo to act. And do you know, right, the former chief of staff of Goodluck Jonathan's government came on air on channels and said it, that the office of the vice president cannot even authorize anything. It's as good as nothing. And that's why when they are saying, oh, Kwankwaso be the Peter Obi be the vice president to Kwankwaso, he said no, because the office of the vice, unless the president dies or allows you to be the acting president when he's away, that's when you can exercise rights. Otherwise, the vice presidential office is nothing but an empty seat. You are just there without any power. You're just following. That's why Osibanjo has been so powerless. Not because he's not intellectual enough, not because he's not a good man, but because his office doesn't have any power. His office, the vice presidential office in Nigeria, is powerless. There's nothing you can authorize. You can't sign anything. I think they are only allowed to choose their own ADC or something like that. Apart from that, even their office, they are like. In fact, I wouldn't even say an extension of the president. So we're in a situation whereby our constitution majorly, but then we need to have a conscious, decision, because this is something that affects everybody. And this is what people don't understand. If you create a society whereby there is no good system, you also suffer from it. You also have to run to another man's country. Okay, what happens if there is probably an embargo on Nigeria to say, you guys cannot fly into our country anymore until you sign LGBT, for example, and then they stop Nigerians from going, to the Western world. Probably they can go to the Eastern part of the world. But then at the same time, we need to sort of look at what if there is a serious need that people, the person in question cannot fly. What if there's a situation that they cannot fly? What is stopping us from equipping our hospitals? If other countries can do it, why can't we? Nigeria is not a necessarily poor country. Nigeria, look at the amount of billions of dollars that the Senate is just finding out that, we've lost through our oil sales. Billions of dollars. And yet we are borrowing money up to the tune of 78 trillion naira. But we are making so much money from the sale of oil. And now they are inviting the Attorney General, inviting the Minister of Finance, inviting all these people, and they are refusing to come to the Senate for questioning on all those allegations. Reason? Because they know the truth. Festus Keyamo of INEC came the other day on National and was saying that their ICT department need to go on sober reflection to find out exactly what happened to IRF on 25th of February. After you told us initially you are not IT savvy, and after all these weeks and months, all you told us you are still conducting election. What is there to find out? Every data has a metadata. So if your system was shut down, you're supposed to know. There's a metadata of when the system was shut down by who. Who is kidding who in this country? Why are we so bent on destroying this Nigeria? Why is there no good people of good conscience who can help this country to wake up for the good of the children unborn, for the good of our children that are there coming up? It's like everybody is out to destroy that country. There is no patriotism. There is no love for the country. Everybody just wants to destroy it totally. How can you tell us that what happened on the 25th of which is already in court, that you've done your investigation and you come out and tell us that you are still waiting for what do you call it? That you are still waiting for your ICT to go on sober reflection to analyze and tell us what happened. That you then review, and then the man went on to say that nobody petitioned them within 7 years of announcing the results. That because the other parties staged the walkout, the process was not concluded at then, but they had to allow the process to conclude before applying. So what they are telling us now is that nobody challenged the results. But then what is the matter in court doing then? If that is not asking you for review, are we silly? Are we really, really serious? I mean, these people just sit down on national TV and think that they are talking to fools and they are talking to uneducated people and, whatever they say is final. And they're in public offices. Oh, the commission has not taken a date on when they are going to do the review. The commission? Who is the commission? Who gave you the power? Do you even understand what public office is? So we're in a system whereby we really need to, just like we're having this conversation, we need to keep educating each other. And it gets to a point, these guys will see, okay, these people don't get sense, so, we can't come and be telling them all these stories. And this is why they are trying to use Adamawa Rec as a scapegoat. But that does not exonerate Yakubu. Yakubu Mahmood said on live television that he made late deployments to all the Southeast states. Why? No explanation. So INEC was arriving on the 25th of February for presidential election at 3 p.m., some places 2 p.m., some places 1 p.m. when you're supposed to be there from 10. Sorry, not even 10, from 8:30. Or let's just say, okay, 10:30 or 10 o'clock. Your people didn't come, and when they come, they start setting up, putting posters up, trying to do because they are coppers, they have to be doing what they are told. So when you look at Nigeria, you see like there are people, especially those in power, they have a conscious, intentional hate for the country. They want to really destroy the country. Because you can't tell me that, I keep looking at UK, man. Somebody in power, not even quite long that he got into power, just resigned for bully, Dominic Raab. Look how many ministers have resigned. Okay, I can't do this. I resign. That is the system. But you have people like Yakubu who has done so badly. All the international observers have said these things was flawed, and you are still there trying to tell the court that you followed what? That you did what? It's so clearly that you are a foolish, failed, out of all the 36, and again, look at how the constitution is so stupid, right? Our constitution has made it like, even Festus Keyamo and some of the people you think that led the same constitution or became senior advocate of Nigeria based on the same constitution, don't even know what they are saying. So now, all the information we've known all our life, that Nigeria is made up of 36 states and the capital, which is the FCT, they're now telling us that Nigeria is 37 states. So, is it 37 states or is it 36 states and capital? Because everybody is confused. Because the constitution is not clear. There's so many issues there. So many issues. And this is why when I'm looking at Peter Obi, I'm saying, when this man eventually gets into power, he will have a lot to deal with. But then again, we have to keep speaking so that whoever is there, whether it's the Minister of Health or whatever, will know what to do. Another thing is, every single person in the UK, for example, have a GP. Your GP should be within a particular distance of where you live. So if I move from where I am now to another city, I will have to register at a new GP. GP simply means general practitioner. That means your personal doctor. So every citizen has a personal doctor within a particular distance. So if you have any illness, you don't go diagnosing yourself. You can't even buy a drug from pharmacy without a prescription. They won't sell it to you. And people obey the rules to the letter. You dare not sell anybody drug, even if it's your own brother or your own father. You dare not, because there's inventory. You have to prove whatever. And the government pays you for that prescription anyway. So the way they get paid is the prescription. So if you give prescription, and it has to be, everything is electronic anyway. So everything has to be electronic, accounted for, and if anything goes wrong, anybody can sue you. So there is regulation for everything, check and balances everywhere. Everybody's being overwatched, everybody is being scrutinized. That is a system. Nigeria, anybody can import anything, any individual can go into production of a drug, any individual can produce any. You see, we have a system where has so much failed. And those people, everybody knows the problem of Nigeria. This is why it is pointless coming to lament over the same problem. We all live in the system, we all know the problems. What we are saying is, what is the solution? Which is what I'm preferring. We need to find a way to make sure that every locality have a doctor. All these things are in the book, like theoretically, it's supposed to be happening, right? But practically, I don't know if it's happening. So every village supposed to have a health center at least supposed to have a doctor. Now, if you don't have a doctor very close to you, there should be a local government that's supposed to have a health center. For example, my village have a health center that is serving about 4 villages, right? That health center is supposed to have a doctor and at least very minimal supplies. So if you have an issue, you can rush your own person there and at least your life is saved, or at least you get administered with first aid, and then you are being transported to the hospital or referred to the hospital. Okay. Now, when that has been done, which is why I said we cannot do it with the public hospitals, because it takes a lot to build hospitals, right? So the public teaching hospitals and the public hospitals and maternity centers in Nigeria, we can still keep those, but then the government needs to sort of use the services of all these private hospitals. Pay for them, even if it's a subsidized payment. I mean, prescriptions in the UK are £99, regardless of whether it is the drug worth £10,000 or £500. Everybody pays £9. The only thing is that you pay other taxes and insurance that comes off from your pay to also help when you are sick. So it is being taken elsewhere to sort of pay for this. So even if you are not sick for 10 years, you will still be paying the tax. But what you know is that whenever you do fall sick, that system is free and it's fair, right? Now, we need to have a system in Nigeria whereby we need to get the private hospitals and tell everybody, if you are in this locality, this is your GP or this is your personal doctor, right? And then this personal doctor, we know the record of everybody that is depending on them as their personal doctor, right? And the private hospitals, the private doctors will accept this, right? Because again, it's their profession. That's what they want. They want patients, okay? I don't want to use the word customers because we're talking about human lives here. So they have patients. Now, when we employ the services of these private hospitals as the personal doctors, everybody in this locality will know, okay, this is my personal doctor. If I have any problem, I will go here, right? When you go there, you should have a record. Not this card system and this paper system and filing system we use. We need to, I mean, these are simple, basic. Even if it's one laptop, employ a secondary school boy or a university graduate and give him, even if it's Excel, as simple as Excel has thousands of rows. What is your name? Simple demographics. So when that person comes, they will be issued with a particular card number. But that card number will be on the system. So whenever they come, they can, I mean, we have too many IT guys that are in Nigeria. So you can actually employ a firm. I mean, we need to get to a particular system or level whereby we can, I mean, there are, for example, what I do, there are health IT systems that, you know, private hospitals use or GPs use, like EMIS, Evision, and all of that. And Nigerians can get to a point, or Nigerian government can get to a point they can buy these products and we can use it. But even if we're not there yet, what I'm trying to say is that instead of keeping all these filing system and a Bagogwa card is 1,000, and all these things, we can have a simple electronic way of keeping record of those who are in this particular private hospital, for example. So that when they come in, you check and see, okay, this person is on our system. And because you're in our system, you can see the doctor for free. But then for every person that sees the doctor, the hospital, or sorry, the government will have to pay that doctor for that patient. So that way, people will know that whenever I feel sick, I need to go to a doctor to at least get the correct diagnosis. Even if you don't make the drug purchase free, let them go and pay for the drug, but let them know exactly what is the problem. And let it be typed. Let it not be scribbled. You know when doctors scribble these things and people can't read it. Let it be typed out on something that's supposed to be a prescription paper. So the pharmacy will have to see the prescription paper and see, okay, only specific doctors have access to this kind of paper. So that means you've already seen a doctor before you are coming to me. And pharmacists should not sell a certain drug apart from paracetamol or simple things like paracetamol and painkillers. Pharmacists should not sell any other drug to anybody until you have those prescription. So you employ the services of private. You will see doctors will be forced to stay. They won't run away again. That will solve the whole jabba issue. And at the same time, that will help our citizens to live longer. Because if you are diagnosed properly and you are treated properly, your sickness will go. There will be reduction on people using those facilities. There will be reduction on people selling quack drugs. Because the thing is, all these people that are importing drugs or making drugs in illicit places is purely because people are using them. My mother, I know for one, goes to this market that she goes and buys drug and store. So she will store it herself, and then if you say you are sick, she will mix it and give you. So you know, in Nigeria, everybody is like their own. You need to learn a little bit of mechanic. So if your car, most people in Nigeria, my car knocked engine once because I didn't know how to drive car in Nigeria. So how they drive car in Nigeria is that you wake up in the morning, you open your bonnet, you check your oil. You check your water. If the oil is low, you top it up. You put water. And then you do other checks before you start and go. The way we drive, anywhere we are going, we just come, start car, they go. So if you use that mentality and drive in Nigeria, engine will knock. So I lost my car like that. And I had to buy another one. So why am I trying to say this? Everybody is a bit of mechanic. Everybody is a bit of electrician. Everybody is a bit of carpenter, and there's nothing wrong with doing things yourself. If you have a bit of skill, if you're DIY, you can. People do DIY here, but then there are things you need to source for the licensed professionals. Things like car fixing. How do we? I mean, I will talk about that in another topic another day. But then what I'm trying to say is that my mother is now a doctor or a nurse herself without even knowing what she's doing. All she does is that she probably knows some key drugs and what they do. So she goes buy those things in bulk, pack them in her akbaogu, and then whenever anybody is sick, she will administer it and then top it up with olive oil and prayer and hope you are well. I don't know how we managed to survive. Maybe our antibodies and immune system, became stronger as they fight the disease, because the body tends to fight a lot of things itself. So, and probably that's how we got to where we are and managed to survive. But a lot of people don't survive. Not everybody is lucky. Not everybody is lucky. What is stopping us from acquiring ambulances? How much is ambulance? How much are all these hospitals making? Hospitals are meant to be firms. They are meant to be organizations that are supposed to be making profit. So what is stopping them from getting ambulances? Ambulances as a system in this UK, for example, are on their own. Right? So they are on their own. They're like a separate sort of company from the hospital, because they know what they do is respond to emergencies, bring the patient, administer help, and then pass on to the. So again, we could get organizations, give them licenses to purchase these ambulances, and depending on how many people they bring to hospital, government should pay them. These are ways to make sure you provide jobs. Two, you help to curb, people dying on transit, people using ambulances for carrying party rice and scaling through traffic and all sort of nonsense you hear from Nigeria, and people getting the first aid that they need. Not only when we want to host any serious event or World Cup, or when you come to airport, they would leave one fire service and one ambulance van that has no equipment in it. So we need to be intentional about trying to fix Nigeria. So we need to start looking at these things and taking it upon ourselves and know that even if others have failed, we can't keep failing ourselves, because we don't have any other country to call our own, the way they say it, or the way Peter B always puts it. So this is my proposal. Let us use the private hospitals as GPs to get more localized help and immediate help to the people. And that in turn will help to provide jobs to our medical students and medical practitioners, and at the same time help our mothers, our old mothers, our young children to get the best medical service, because we have the right brains, we have the right human resource. All we need is to put a right system in place. And then whoever is in charge of providing supplies, medical supplies, should make sure they don't falter, because these are human lives. Human life should be valued in Nigeria. A lot of people are dying. Almost every family have lost somebody to bad system of health or the hospital system in Nigeria. And this has to stop with somebody. This has to stop at some point. Other than that, if we continue in this circle, we are going to end up, deteriorating further. And before you know it, all the poor people will die and only rich people will be entitled to life. And it's not supposed to be so. We need to build a very strong system that all of us can be proud of, and all of us can know that even if we die for our country, that the system will make sure our children and our families are protected. I'm going to stop here, and thank you so much for listening to me.